Welcome to Talk Mental Health with Logan Noon. This is episode 14. I have on one of my real inspirations for going into medicine, and especially going into medicine with really an open attitude of disclosing my mental illness, Dr. Vania Manipod. Also, you can find her on Instagram at freudandfashion.com and at freudandfashion on Instagram. She is really open about her social anxiety and dealing with burnout as a physician, and I really think you guys are going to enjoy this conversation. We really started communicating, I think it was probably about 4 years ago via Instagram.
Yes.
And so I remember you had a post about kind of your social anxiety, and you were a psychiatrist, and you were really the first physician that I saw that ever was open about their mental health issues. So what motivated you to suddenly be open about your struggles?
Well, it was definitely a process because I started blogging during residency, and I found that it just became more natural, I guess, my writing style to try and connect with people, to reach a point where I felt comfortable just talking about my social anxiety, because I found that was very therapeutic for me. I was already in therapy, and I think that definitely helped. And blogging about my experience kind of showed how my progress in working on my social anxiety evolved and improved to the point where I just felt really open. I was like, there's so many people who struggle with this. I'm not the only one. Why can't I just be open about it and share? Because I feel like there's comfort in knowing that you're not the only one, which is a problem, I think, amongst, when dealing with psychiatry or mental health or having a mental illness, is that everybody feels alone. So why can't we all just share in our struggles?
Yeah.
Yeah.
And
as a physician,
mm-hmm.
I kind of thought I can't be the only physician struggling with this. And I think if my patients knew that I'm not perfect, I feel that I would connect better with them.
Yeah. So back when you started opening up about, your struggles, we see burnout all the time in news with physicians and medical students. But back then, like 4 or 5 years ago, was it really a hot topic? Were there still like the stats they were throwing around like they do today?
It wasn't as easily accessible. I had to search a lot just to figure out what was going on within myself. So I would Google search terms like physician, like lethargy, or, trying to think different things to find out, like physicians who are struggling at work, just to find out. And I remember coming across kevinmd.com. There was an article that someone shared on Facebook. And I was like, oh my goodness, that's what I'm going through. But it was the first time I ever heard about burnout. So it kind of got me to this point where I was just like searching for anything related to it, because I wanted to know what was going on in me. Because even as a psychiatrist, I couldn't identify it in myself. But I don't think it was as easily accessible, because I had to really, really delve deep and try and search for stuff, compared to now, where it's like a hot topic and there's more surveys being regularly, put out there and published. They're talking about it more in school and stuff like that. So definitely not so accessible back then.
Yeah. Yeah. So when you started blogging, you were already a psychiatric resident, and your blog is freudandfashion.com. We'll make sure to put a link to that in, all my posts and everything, so you can find her Instagram page and her website. She has a lot of really great articles. But when you first started blogging, it wasn't initially about like social anxiety?
Oh, no, actually, I first started blogging. I tried to be a fashion blogger.
Oh, okay. I was always wondering why Freud and fashion. I don't know.
I tried to combine, because my whole point in blogging, this was before even fashion blogging, like it was just blowing up. I was like, how can I combine my interests? So I had an interest in fashion back then, not anymore.
Okay.
I'm not fashionista. And psychology, so I thought Freud and fashion. But I realized, you know what, I'm not really interested in posting my outfits, because I really don't dress up often in residency. You're just wearing like whatever you can basically throw on because you're so tired.
Yeah.
So, yeah.
Well, that's awesome. And I'm glad you certainly kind of made that transition. And one thing I really like about your social media presence is that you don't always show like the pretty stuff. Like you show your bad days, like when you're grieving or, when you're stuck in traffic and just pissed off, or like you show kind of the bad stuff and the full spectrum. And that's one thing I know that in my own like social media feed, I don't really do enough. And so I'm trying to make a better effort of like just being a little bit more vulnerable, showing how I'm kind of a piece of shit sometimes and I don't always have everything together. And I actually just did a podcast about that a couple episodes ago, episode 10, I think. I don't always have my shit together. Just talking about how, like, I think, what is your opinion on social media and mental health? Like, do you think it inhibits someone improving their mental health? And how do you advise your patients to manage their pages?
Yeah. Well, first of all, I actually think that you do a pretty good job so far at trying to express your vulnerability and how you do struggle and you try to be open. And I feel like, it's reflective of your comfort level about talking about your struggles. And I think it'll eventually evolve over time. But I just found it interesting that you don't think you do, because I think you do a great job at it.
Well, thank you. But I think I could do better, certainly.
Okay.
And because,
okay, I'll do better.
Yes, because I've always at least going, before I post something, I make sure it looks all cool with the right filter and all this. And I realize I just need to almost focus more on actually posting things rather than how they really look. Just kind of getting content out there to just try to make people feel better. Because at least what I talk to with my colleagues a lot of the time is how you go on Facebook and it's really easy to get envious and jealous of what you see in other people's lives. So how do you advise your patients when, they're basically having like Facebook depression?
Yeah. Well, actually talk about social media every once in a while with my patients. Like if they're, on summer vacation and maybe they're stuck in summer school, or they can't afford a nice vacation, or if they're going through a breakup or divorce and, trying not to look at social media. Because there are some studies out there that talk about how, as far as even, for example, a breakup, that you just prolong your grief and overcoming the breakup even more when you actually look at their accounts and you're looking at, of your ex. So I'll try and bring some of that up to kind of remind them, I understand it's hard to distance yourself from social media, but that's what you need to do if you're going to recover faster. But as far as educating them, I mean, I can even relate with my own experiences and how sometimes looking at other people's posts kind of depresses me. But I also have to remind myself, like, look, this isn't reality. Oftentimes people try and convey that they're happier, via social media than how they are on the inside. And I can't assume that just because they're posting pretty pictures that that's truly how life is. So knowing that I have to remind myself, I kind of encourage my patients to do the same.
Yeah.
Yeah. But it can help. Like, for example, with your social media and your vlogging, I feel like it can help in those ways. And I try and do that with mine to be realistic too and show that there's ups and downs in my life. But it can definitely be detrimental because for a lot of people, this is their social media is their job. So they have to put pretty pictures out there. And I try to remind people, this is a business. It's not necessarily reality. And we have to always remind ourselves that.
Yeah. Do you talk to your patients about how much time they spend on social media in a day or even just like on their phone randomly? Because I imagine, I don't know if there's any studies around this, but the more time you spend on social media, the more time you spend just screwing around on your phone, probably the less in the moment you are, and therefore maybe the less happy you are as well.
I haven't actually, it hasn't really come up, but I have written about how there's a study that says that if you have your phone just on the table, like if you're having dinner outside with like somebody, friends, or your significant other or whoever, that it actually changes the conversation a lot just by having your phone there. So,
yeah,
there's a lot of, I don't really talk to my patients about it. I don't know why, but there's a lot of good data out there that talks about how conversations can change and how people can feel more anxious and have sleep problems as a result of constantly being on their phone.
Yeah. Well, there's one tactic that me and my fiance have been kind of using, because we found like if we both have our phones, we'll be talking about something and then we'll be like, oh yeah, well, let me show you that place, this picture, or, let me pull up, let's double check that fact because I'm right, you're wrong kind of thing.
Right.
And so what we've been trying to kind of do is like, if we go somewhere, let's only have one of us bring our phones. Like if we need to get reached, someone can reach one of us. It's not that big of a deal. And what that really turns into, because only one person has their phone, is you don't want to pull out your phone because the other person doesn't even have their phone. And so therefore we just end up spending less time on the phone and we're a little bit more intimate with each other and have better conversations. So I really have been trying to encourage a lot of my friends to do that, because it just seems, at least in medical school and people around my age, I don't even know how many hours throughout the day they probably have their phone and their eyes locked on that phone. It seems like 12 hours a day.
Right. It's pretty substantial. I don't know. I'm kind of scared to even know how much time I spend on my phone as well.
Yeah. Yeah. Well, and it seems like you said, almost part of your job is that you now have to be on your phone because, you do have this big social media presence and a big following, and, you are like the expert, at least I see, for physician burnout in the country.
Oh, wow. Well, thank you.
Well, I mean, are there other Instagram pages out there of physicians who openly talk about burnout as much as you?
Instagram, not as much. But I did learn a lot from Dr. Pamela Weibel. She blogs a lot about it. But yeah, I do talk about burnout a lot because I try and target, because I think the average age, I don't remember, of the people on Instagram. I know it's low, like it's like late teens or early 20s, something like that. But I'm trying to target our future doctors, future healthcare professionals, because I do believe that if I was actually taught more about burnout and how to prevent it, and like early on in my training, I think I would have been better at identifying it in myself. So that's actually my goal, why I'm active on Instagram.
Yeah. And so you originally were open about your social anxiety, and you still are, but it initially wasn't about burnout. So when did really that sensation of burnout start for you?
Right. True. So when I first started blogging in residency, I talked a lot about the hardships trying to balance personal life with residency. So nothing about burnout at the time, but as I started to experience burnout in my first job after residency, I looked at the pattern of my posts and saw, wow, this is kind of something that's been growing and building up over time. It wasn't just all of a sudden, boom, burned out. It's just a buildup over time, which is really what occurs from probably our pre-med years. And I started blogging more actively, specifically about my burnout experience, when I knew, like, this is what is going on. I can't find enough articles or personal posts out there from physicians describing their own experience. So I'm going to go ahead and just discuss my own experience and just put it out there. As scared as I was about judgment from people in the medical field, I put myself out there because I felt like it was something that had to be done.
Yeah. And so I've read your posts and seen, your videos about that experience. So if I'm remembering correctly, you were just working like crazy, right? And just like trying to, basically motivated to try to pay off your loans like as fast as you could. And so you were working, how many hours were you working then?
Well, I think the average physician probably works anywhere from, up to 80 or 100. Yeah. So I probably wasn't really counting. And it wasn't necessarily just the work hours. A huge part of my burnout experience was also, how do I describe this? My ideal way of practicing medicine wasn't aligned with my employers.
Okay.
So, I like to spend more time with my patients. And obviously, if you have a huge list of patients, you're not able to practice medicine the way that you want because you're so busy. In addition to all the administrative tasks, which is also a huge component of physician burnout. So administrative tasks, in addition to me having lost patients to suicide in my, a couple of years into my job, all of those things just eventually I couldn't take it anymore. So it's a lot. And that's the problem, is that we can't really pinpoint a reason. It's a lot of factors that contribute to you feeling burned out.
Yeah. And what type of entity were you working at then? Was it like an inpatient setting, a large hospital, or?
It was outpatient, and I worked for a big medical group.
Okay.
Yeah.
And then now you made a switch though into like a smaller private practice setting?
Right. I work for another psychiatrist, and I work per diem, which means you get paid by the hour, but I have flexible hours, and I am in private practice. And even though I still see a lot of patients, I feel more in control. Yeah. And that's a huge difference.
Yeah, you really talk a lot about like kind of work-life balance, and that's something I really want to emulate in my future career, is because I'm worried. I just know the stats how like physicians are at greater likelihood of divorce and substance abuse and suicide, and I know being someone who lives with bipolar disorder, at least the substance abuse and suicide I'm at greater risk for. So I really want to focus not necessarily on making the most amount of money in my career, but having the best kind of like work-life balance and just being able to manage all this stress. So, when you were experiencing burnout, you were able to kind of make that switch where you were able to kind of just have that better balance in your life. But we were talking about earlier, most of my listeners right now are probably medical students. Unfortunately, we're not in a situation where we can really lessen our load. So what would you advise to medical students who are starting to really get resentful towards school, maybe feel burnt out, depressed, totally out of energy? What would you tell them to do when they really can't, like I said, lessen their load?
Right. As medical students, we have practically zero control, at least as far as our workload and the pressure placed upon us. But I talk about this a lot when I talk to students, and it's kind of hard because one of the factors that have been shown to reduce burnout among students is actually having a mentor, which is easier said than done, because oftentimes you can't just like reach out to somebody and be like, hey, can you mentor me? But having a mentor actually does help, because that's somebody that you could talk to, who can encourage you, who you can vent about the things about, and who you can look at and visualize your life being, because maybe it's a physician that you admire and you want a practice like that, and you see how happy they are. So you recognize that I just got to put hard work now, because then eventually I could reach a point where they are.
Yeah.
So having a mentor. And after my talks to medical students about burnout, people always come up to me and ask, like, I'm really burned out, what can I do? And I ask them, what do you do during, I guess sometimes you'll have like maybe one day off, sometimes, right? And I ask them, what do you do on that day off? And they're usually saying, well, I'm doing work. I'm trying to catch up on, I don't know, something. It's something work related. Yeah. It's not really relaxing. So I always tell them, well, it's hard. I know it's hard for students, but can you do something that you actually enjoy and for yourself? So you could actually allow yourself to rest. And most find it very difficult. They usually give me a look like, how do I do that?
How dare you?
Like, what? Like, how?
Yeah.
How does that happen? But it's a skill learned over time, I would say, for a medical student to actually go to yoga or, hang out with friends.
Yeah. Well, and I really think it then comes down to boosting efficiency, because if I try to go on a Saturday, like tomorrow, Saturday, I am already behind in my renal system, of course. Right. But if I set a goal of trying to study 12 hours tomorrow, by the, 7th hour, I'm going to be really exhausted, and I'm just going to be kind of, not really focused and not really retaining much of the information. So, what I'm going to plan on doing this weekend, I hashtag it all the time, golf therapy. I'm going to go golfing in the middle of the day. So I'll work really hard in the morning, looking forward to going golfing, where I can just clear my head and not think about anything else besides not trying to slice it into the woods. And then after golf, I'll be able to really focus and be a much more efficient studier. So, I'm not going to get that 12 hours of studying. I'm going to get 8, but it's going to be a much more beneficial net studying experience.
Right. I like that idea. It's rewarding yourself. It's actually scheduling it because you
Hmm.
schedule it. Was it golf Fridays?
Golf therapy, I call it.
Golf therapy.
Yeah.
Golf therapy. So you're already telling yourself like this is on my schedule, that this is something I'm going to do.
Yeah.
So you are prioritizing it. And I think that's what would help a lot of people is if they said, this is a priority, I'm going to work my schedule around it.
Yeah.
Get studying done beforehand and after.
Well, one thing, I don't know if you found this in medical school, but like when I hang out with my friends from medical school, it tends to be that we only talk about medical school.
Oh my goodness, yes.
And I think that's so unhealthy. And thankfully, I live with, my fiance, she's not in medical school with me. And so she always reminds me of this, like how we have to still develop ways to talk. And so, like, I never want to give up my passion of golf and never give up my passion of skiing or going to concerts, because I just think if you become like 100% a med student, that is just your life. And I get it. You have to dedicate so many hours and time and energy to passing, but that can't be it. You have to have other aspects of your life that you're still passionate about, because it's just going to eat you up inside if that's the only thing.
Right. And I think that's a great point. I love that your fiance reminds you of that. I think, no, this is different. I wish I knew burnout rates in Europe, where they're required to have a
Yeah.
gap year to do something fun, explore, find themselves after high school before they enter college or the workforce. I feel like, at least in the US, like I feel like there's so much pressure to not take a break, to actually travel or do things we enjoy and just to keep pushing through, go high school to college to med school or whatever, residency, no break in between. But I feel like if we had more of an identity beyond just being a medical student or just being a physician, I feel like we would recognize more the importance of doing things outside of medicine.
Yeah. Well, and I just kind of look at it as how our society defines success, because at least, in American culture, it's your house, your car, how much money you have in the bank, and really much of the conversations and the careers that people are choosing or they're trying to go into at my second year of medical school, it always seems surrounding by how much money they're going to get paid. And they always talk about, the average salary of a orthopedic surgeon is, $700,000 or something crazy. And it just seems so much of the motivation is really all financial, and that it just grinds my gears. And I feel like I can see some of my colleagues setting themselves up for burnout. And if that's the only thing that they're chasing. So what would you advise a medical student who's really thinking about the money only?
Right. Well, there's a lot of research out there with positive psychology, and there's a lot of research with positive psychology that talks about how money is not a factor that contributes to happiness. It might be something idealized as defining success, but a lot of people who have money are not happy. The factors for happiness are actually feeling that you're doing something that you're skilled at. So, which is why I always tell people, pick the specialty that you actually love and are passionate about, not just something that seems easy to get into or makes the most money. So doing something that you're really good at, doing activities you enjoy, like golf, and also having meaningful connections and relationships. So investing time in our friendships and our family. So nowhere in that is money. Sure, money can help you do things, activities that you enjoy, but you can do things that don't cost that much also. It's like it's necessary. So that's something that...
Well, I always bring up that study, and I forget what the exact figure is, but it's like anything past like 80 grand isn't necessarily going to make you any happier anyway. That
study.
And it's kind of like if you're single and you earn 80 grand, like below 80 grand, making more money does actually make you happy. And then once you get to that level, it's kind of just plateaus. And then if you have kids, obviously that 80 grand it does need to go up. But I think if you have an average family of like 2 kids and a wife, I think it's like 125, something like that. I'm probably butchering the numbers, but I know there is a study and it's right around that figure. And so what I always remind my classmates is like, okay, listen, the least paid specialty is probably like pediatrician or primary care physician. At the end of the day, both of those careers are significantly higher than that $125,000. Like, you are still going to be a happy, satisfied physician, even if you go into one of these specialties that's not necessarily the highest paid. And
Right.
It's really daunting, I feel like, for medical students, especially osteopathic medical students, because many of the times it's private schools and it's like, $70,000 per year. So we're graduating with a significant amount of debt, but that's what I at least try to have a lot of my colleagues focus on.
Mm-hmm. More money, more problems, I suppose.
Yeah, right? Biggie had it right.
Yes. That's really interesting because I feel I didn't know that that is such a common conversation still, because there were probably like 12 people in my medical school class who went into psychiatry, which I
Wow.
mean get paid pretty decently,
Mm-hmm.
more than pediatrics and most primary care, but it's just so interesting because I never really engaged in those conversations, but I could see how that could be a predominant discussion.
Yeah. Yeah, it's a little frustrating. And maybe this conversation will change after we actually take board scores or take our
Yeah.
boards and get our scores, because then it's maybe a little bit more determinate of what we actually can achieve. But right now it is, like, for instance, on campus, I'm president of the psych club. We have like, let's call it 30 people, and the surgery club has like 150. And it's just, we end up our school ends up placing more psychiatrists than surgeons. So it's just like, whatever. But
Wow.
now, when
Actually, a surgery to psychiatry is a very common switch.
is it really? Wow. Okay, I'll have to bug my surgeon colleagues or wannabe surgeon colleagues about that, how they need to make the switch. But so now, when you were in medical school, did you know you wanted to be a psychiatrist from the get-go, or was it not until you started doing the rotation?
It wasn't until I started doing actually didactics. I think it's the second year.
Mm-hmm.
Yeah, second year. Because before that, I thought, I want to be a cardiologist. They make more money. I actually did think that.
Mm-hmm.
Now that I think about it, maybe in the beginning you are thinking more about money until you actually start realizing what you're interested in. But it wasn't until didactics, because I actually loved going to class, even if it was at 8 a.m. And it just stuck with me, just the psychological concepts, and trying to understand human behavior. So, but it really was my psychiatry rotation, my clerkship, that just solidified it even more. Yeah. Because that's why I truly believe, I know it's hard to get your ideal clerkship or rotation sometimes at the right sites, but I feel like that can have a huge influence on your decision of specialty.
Yeah. Yeah, certainly. Well, let's kind of transition this conversation into, I'm a DO student and you are now a practicing DO doctor. So when a patient comes in to see you and they're like, "Oh, you're not an MD. What the hell am I doing here?" What do you tell them? How do you define osteopathic medicine?
Well, you mean what do I tell them, or in lay terms, or my own?
Well, either or. I just don't want to hear the generic version that the AOA has on their website.
What do they have on their website?
Well, I don't know. Or just like, AT still, blah, blah, blah.
Oh, gotcha. Okay. So here's how I describe it just in general, because I also do some media promotion of osteopathic medicine. And it's always encouraging, starting off any type of media interview, saying I'm a DO, which is different in its philosophy, where we emphasize mind, body, and spirit to address our patients' needs and approach their health. So it's really more about the approach and the philosophy that sets us apart, I would say, that's different. And I really don't really mention osteopathic manipulative treatment that much. It's more the mind, body, spirit type of approach.
Yeah. So for the listeners who don't know osteopathic manipulative medicine, I kind of say it's like if physical therapist and chiropractic medicine kind of had like a baby. I feel like it's very synonymous to both, and it's similar in some ways to each. Have you done any OMT since getting your license?
I have not. And I do mention all the time that I wish I was good at it. There's actually a study that shows that if your residency program teaches it a lot and emphasizes practice, of osteopathic manipulative techniques that you're more likely to practice also once you're done with residency in your own practice. So I do not.
So I'm basically super committed to psychiatry. It's like the reason I went to med school in the first place. You know, you were a big reason for me getting here, a big inspiration for me. You wrote me a letter of recommendation. Thank you again. But you see OMT still having its place even in a psychiatric practice?
I do actually, and I think they do it a lot at is it Michigan State or University of Michigan that they have a DO school? Well, anyway,
Yeah.
Michigan State, I think.
Yeah.
I know they have a program there where they try and incorporate psychiatry and OMT.
Okay.
So I have not seen it done, but I can envision, I can see how it could happen, how it could work. It's kind of like, you know, if someone did OMT on a patient, if a DO did OMT on a patient who's also a psychiatrist, that I could see how it could bring up some stuff as they're going through the treatment. And if they talk about it, I could see kind of how they can combine the two. Though I've never seen it done,
okay.
I can envision it.
Yeah, because I'm a little nervous just because, you know, I know moving forward, a lot of my patients are potentially going to be victims of like sexual assault. And so I can't imagine, you know, me touching their body is going to really soothe any of their potential symptoms.
I mean, definitely a case by case basis, but I could also see where maybe for chronic pain, because in our practice, we see a lot of chronic pain.
Yeah, absolutely.
And there are times with my patients who are just really frustrated with being on opiate medications and medication after medication, who really want an alternative approach. And there are those times when I feel, gosh, I really wish that I was good at OMT.
Yeah.
Because I can see where that could be of benefit.
Okay. You're motivating me to study a little bit harder here, Dr. Manipod. So thank you.
Right.
Yeah.
I think that there is a study. Well, I don't even know if there's an actual study, but I remember reading about it that people, when we practice OMT, when DOs practice OMT, that it does decrease the amount of pain medications they're on.
Yeah, I certainly believe it.
I'll have to look that up.
Okay.
But I'm sure there's cases.
Have you ever read The Body Keeps the Score?
No, I haven't, but I've heard about it.
Okay, yeah, I haven't read it all the way, and I've been listening through it, but really, his theory is how, it sounds almost very osteopathic, and even though he's an MD, how when you go through a traumatic scenario, your body literally essentially keeps the score, and you can keep that trauma, and essentially sense that trauma in your body years after. So I think, so that's kind of where I'm getting a little motivated with OMT. It's like, okay, maybe can I essentially provide some, I don't want to use the word massage because they get mad when they use the word massage in our OMT class, but like ways to just relax some of these muscle tensions when someone goes through an incredibly like stressful event.
Mm-hmm. I actually can see that because I think I posted this recently on Instagram, a study that shows that people who have PTSD are more likely to have chronic pain.
Mm-hmm.
So, sorry, what was the question?
I don't even know anymore. It's Friday. We're both a little brain dead anyway.
Right. But yes, I do believe we carry the trauma in our body. And that recent study I thought was actually pretty interesting because it was the first time I ever saw that it was actually in a research published.
Yeah.
Yeah.
Well, the last topic I want to kind of pick your brain on here is a big reason for me starting this podcast is that I eventually would love to have a telemedicine-based practice. I just think, you know, the mission of the school I go to is serve rural and underserved communities. And I look at serving rural communities is really impossible if I'm going to be driving all around like the Pacific Northwest. It's just, there's too great of distances. But I think, you know, FaceTiming like we are now is going to be a way that psychiatry can really serve the needs of these patients. So what is your opinion on telemedicine for psychiatry? I
think it's great. I have some friends who are psychiatrists who do telepsychiatry. And aside from the fact that they get to work from home, I know that they see patients who don't have access. So maybe even in prisons, mm-hmm. or rural like hospitals where it's really hard to get a psychiatrist to come out.
Yeah.
And just places where the closest psychiatrist is like 2 hours or something like that.
Mm-hmm.
So I have seen where that's the best option for them. There's a lot of flexibility in scheduling, and there's a huge need. So the only thing I get concerned about sometimes is because I'm huge on psychotherapy.
Mm-hmm.
I worry about that kind of therapeutic connection from just being on, a screen. But if it helps, I mean, I've tried doing that with my own therapist via telepsych.
Yeah.
Telepsych sessions. If it helps and it's the only way that you can get therapy or treatment, then I think that's great.
Yeah, but you're right. You certainly do sacrifice some of the maybe intimacy, that human connection when you're talking through a computer screen. Like I've tried telemedicine with my therapist and it's been okay, but then I sometimes get nervous. I'm like, oh, like, can my neighbors hear me? Like, am I saying some shit that's going to freak them out or, like stuff like that. So I definitely have some concerns. So do you see yourself ever going into telemedicine or using it at all? Like being a provider?
Right. I actually have thought about it because I work part-time and I've tried to think of ways that I can maybe see more patients on
Mm-hmm.
days that I'm off. Maybe even do some therapy in my own practice, like through telepsych, because my hope would be actually to do more therapy. And if I had more access to people maybe that aren't local who maybe really want me as their psychiatrist, then they would at least have that option. So I have thought about it, and that's the beauty of my schedule is that I'm trying to find other ways to divide my time.
Yeah. Well, I was laughing. I just saw you just went on vacation to Cabo or whatever, and you got engaged. Congratulations. I'll officially say that on the recording again. And you were saying, like, I would love to have a practice here. And I was like, well, you could do a telepractice down there quite easily. Just like out of your hotel room, essentially, if you really wanted to.
Yeah, I mean, actually, I don't really know because I have to clarify this. I heard someone told me that you actually have to be in the state when you do it.
Oh.
Yeah, someone told me that, like in the US or something. So I remember asking someone, like, if I was on a boat, like on a cruise, could I do it? Or something like that. And they told me there might be some limitations there. But
what? Oh, you're crushing my dreams here.
I don't know. Don't quote me on that. And this was years ago.
Okay.
Telepsych has evolved since then.
Okay, I'm gonna have to advocate for being a doctor on a boat and just telemedicine one day, because we actually had that conversation in school today. It was pretty hilarious. How we all wanted to just buy like little mini yachts and like just like go all around, and we're all gonna be telemedicine doctors.
How cool would that be?
So I guess now one more last topic, because I kind of forgot this about you. You are, I feel like, a really unique psychiatrist in that you provide your own psychotherapy too.
I try. Well, that's my goal to do more, like actually have 45-minute sessions. But I actually have developed my own style where I really probably sometimes spend like less than 5 minutes doing med management, and the rest of the time, oh, sorry, it's loud.
That's okay.
Okay. And the rest of the time is just kind of some type of therapeutic type questions or discussion. I feel like if I had a student and they saw it, they would get it.
Okay.
I feel like it's hard for a lot of people to see that it's possible in like 15 minutes, but it is.
Okay. Well, hey, I'm a student. Please take me on. I'll shadow you down in LA. I'll figure it out. Because that's what I really emulate is providing some sort of therapeutic value for my patients, because I feel like if I'm just doing medicine, medication management, that is, I'm not really helping them to the full capacity. And I actually just started seeing a psychiatric nurse practitioner, and she does now my psychotherapy too. And so it's such a better experience, I feel like, because we can go back and forth between talking about our medicine and then like practicing CBT.
Oh, that's awesome. So they actually get training I didn't know that. I didn't know they got training in therapy.
I don't know if she did like a fellowship or a clerkship after, or yeah.
It's possible. Yeah.
Yeah.
Oh, that's awesome. Yeah, I feel like that would be the ideal situation. And that's why a lot of my patients actually ask if I do therapy. And I always tell them I wish and I will at some point, but not the 45-minute type sessions. How many minutes do you get?
It was 45 minutes, yeah.
Wow.
So what holds you back from being able to provide that? Because I thought through your residency at Good Samaritan, which I've actually looked into potentially doing because it's an osteopathic one, I thought you were trained in psychotherapy.
Oh yeah, we definitely are. It's just in practice, it's the whole insurance type
Okay.
issues.
Mm-hmm.
Because our practice takes insurance, like even the low income population, we take low income insurance. So it's all about practice survival at that point.
Yeah.
Sometimes you do have to shorten your visits.
Yeah.
To be able to stay afloat, which I hope that patients understand that. Like as much as I wish that I could have longer, oftentimes for a practice to stay afloat, we really can't do like a full hour, you know?
Yeah.
So
Absolutely.
that would be ideal. That would be ideal.
Yeah. Well, cool. Well, I want to thank you again for coming on the show today. I hope you had a good time. And
Yeah.
I hope that you're willing to come back on because I need a lot of episodes and I want to be as consistent as I can about this because, I really look up to you and what you're doing on Instagram, how you're always putting those Instagram stories and thoughtful posts up. And that's just not something that I do. So I at least try to put up thoughtful podcasts. That's like my now contribution to this whole social media world.
Well, I love all the topics you're bringing up. I do refer a lot of students who direct message me about being a medical student and mental health. I refer a lot of them to your page.
Awesome.
Your
Cool.
Yes.
Thank you so much. Thank you so much for tuning in to episode 14 with Dr. Vania Manipod. Remember, you can find her at Freud in Fashion on Instagram. You can visit her website, freudinfashion.com. She really puts out some great materials. If you guys enjoyed the podcast, I would greatly appreciate it if you rated the podcast. That helps other people who I'm not connected to really find out that I'm doing this. Also, be sure to tune in next week. I have on Zach, who has a very interesting story. He left med school, but it's a happy story. I feel a lot of people, when they hear someone left medical school, they automatically assume that it's a sad story and that they're super depressed. So Zach really has an interesting tale to tell, and I think you guys are really going to like that. Next Wednesday on Talk Mental Health with Logan Noon.